Jill's interview is used to introduce good interviewing skills and the structured problem-solving technique.
Jill is a 30-year-old mother with acute depression. Her case demonstrates the value of good interviewing and the use of structured problem-solving. There are many skills in interviewing, but we are concentrating on the 4 skills that encourage the patient to say what really concerns them. These skills are obvious but hard to do well. They involve an open invitation to talk, like, "How can I help?" and good attending behaviour, even if the doctor is writing sometimes. The next 2 skills, verbal following and minimal encourages, are more subtle. The clinician doesn't interrupt, takes cues from the patient, and uses head nods and verbal encourages like, "and then?" She might also restate the patient's last words to keep the patient on track. Now, with those skills in mind, review Jill's consultation.
How can I help?
I'm anxious and worried all the time.
About?
I don't know, I just lie awake and worry. I'm pretty lonely now that my husband's working 2 jobs. I know it's stupid and I do exaggerate, but I often fear that the children and I will be murdered in our beds.
Oh, is that right?
I sometimes think the petrol station where Jack works will be held up and he'll be hurt. Everything's just a constant worry to me.
Anything else?
Well, I'm not any better during the day. I get cranky with the kids and myself.
So, you're depressed?
Well, not really.
What was the doctor doing that stopped this patient talking? The doctor invited the patient to talk and did follow for some of the time, but because she wasn't paying attention and there were few encouragers, the patient decided not to tell the essential things. Let's look at it again with the 4 skills in place.
How can I help?
I'm anxious and worried all the time.
About?
I don't know. I just lie awake and worry. I'm pretty lonely now that my husband's working 2 jobs. I know it's stupid and I exaggerate, but I often fear that the children and I will be murdered in our beds.
What?
Or that the petrol station where Jack works will be held up and he'll be hurt. Everything's just a constant worry to me. I'm not normally like this.
No. Anything else?
Well, I'm no better during the day. I get cranky with the kids and then with myself for getting that way. I'm not eating. My clothes look terrible on me. I seem to have lost interest in everything. I don't want to see my friends anymore. I don't feel good enough for them.
Are you depressed?
Well, I suppose I am. I'm sorry.
We're talking about serious stuff here.
There's actually no reason why I should feel this way. When we decided we needed to pay off the house, I thought I'd be easily able to handle it. But I'm so down. I'm no good to anyone, not the kids or myself. I know I'm lonely and a bit stressed, but I didn't expect to feel as down as this.
How long's it been going on?
Jack's been working 2 jobs for about 4 months now. And I started to worry about the security then. But it's been over a month, you know, not being able to sleep and feeling worried and depressed.
Are you starting to feel that life isn't worth living?
Well, things aren't great for me, but I'd never suicide if that's what you mean.
Well, now you've heard and seen the 4 skills in use, so it's a good time in the consultation for the doctor to summarise the critical aspects of what the patient has been saying over the last couple of minutes. The summary statement should always contain a qualifier to allow the patient to agree or disagree. They confirm for both doctor and patient what's important.
Okay, let me tell you what I've heard. 4 months ago, your husband took on an extra job so you could both secure your house. You thought you'd manage, but you started feeling scared at night, and that was unexpected and demoralising. So now you're feeling depressed, preoccupied with black thoughts, feeling bad about yourself, lost interest in things, can't sleep, and are losing weight. And generally you're at the end of your tether.
That's right. But it seems silly to bother you with my weakness.
Once you're satisfied that you've gathered sufficient information to make a diagnosis, the next step is management. You may need to prescribe medication, and there are essential steps in prescribing. Tell the patient what's wrong with them in pathophysiologic terms. If appropriate, discuss the treatment options, tell them what you're going to prescribe and why. Tell them how to take it. Tell them what precautions and follow-up visits will be necessary, and tell them what you expect the treatment to do. Let's look at an example.